We are talking to Cape Ann historian Les Bartlett. Hi, Les, how are you today?
Hi, Heather. Hi, Corey. Good to see you again.
Seeing you.
And you have new research on the 1918 pandemic for us.
Yeah, as a follow-up to our talk, I guess whenever it was before, I've spent more time looking at what were the pre-existing conditions in Gloucester and Cape Ann to the epidemic, what was going on during it, and then more fascinating for me is what happened subsequent to 1919 and after that. Because as we know, you can go out and Google and find 1918 flu and get the COVID-19 in the same blog, in the same piece. Right? And it's a milieu, a mixture of, well, nothing changes, the same old things happening, look, and so on. But there's some really stringent conditions that were at work in 1918 that we don't experience now. Number one, there was no internet. That's easy enough to say. There was no television, so we wouldn't be looking at each other talking. There was no individual telephones. The telephone system was by switchboard operators only. And one of the pieces that I came up with was an article from New England Telephone saying, look, with this is 1918, 1919, saying, you know, this flu has been so devastating to our employees, several hundred of whom have to stay at home, that we're asking you only to make phone calls if they're an emergency. You know, and I realized, oh my gosh, with switchboard operators, you know, these were the people that would make the connections. Mm-hmm. So again, one of the differences is that we can just pick up our smartphone. I would say, a way to make it the same now is take your smartphone and throw it out the window, because it didn't exist in 1918, right? Take your radio and throw it out the window, because radio had just been invented and was basically being used and field tested in World War I in the European theater. There were no radios in people's homes. So how did they find out about this? It was newspaper and word of mouth. Now, to give you the scale, it's in early September of 1918 that the flu comes in with the sailors through Boston, through Philadelphia, and it spreads like wildfire. October 2nd, the Boston Globe has a brief article stating that in Gloucester on October 2nd, 13 deaths had been reported the day before. And it is at that point that the military comes in and establishes the military tent hospital facility at Addison Gilbert. It was a military operation. The only equivalent would be to say, if the federal government came to Cape Ann and set up a tent city. Now, although there had been 13 deaths on October 2nd, from September 1st to October 2nd, Gloucester had recorded 112 deaths. I came across in research one article from 1919. I haven't been able to get back to it, but in reading it, it was reflecting what the highest per capita of death per 100,000 inhabitants was in the United States. Gloucester, Massachusetts had 9.4 deaths per 100,000. I think that number's inflated because they didn't have 100,000 people. Mm-hmm. So there's a statistic, but nationwide it was 5.2 deaths per 100,000. So we are sitting where the greatest number of per capita deaths occurred. That's pretty extraordinary.
Mm-hmm. And that can be accounted for by the sailors in Boston Harbor, right? In coming into
That's correct.
Boston, yeah. And then maybe living in Gloucester, traveling north to Cape Ann.
Just traveling, and so I got to jump ahead of 1919 for a minute, because just as we really don't know the origins for COVID, or even not really knowing is it asymptomatic. I was reading last night that even a test, if you choose post negative today, you could be positive tomorrow. It just means that at that moment of the test, I'm negative, right? So it's 1919, and they have no idea where this flu is coming from or how you get it. And the military establishes germ squads. And the germ squads, where they would take the young, healthy men and say, okay, we're going to quarantine you for a month in Norfolk. So again, this is the condition. This was not on Gloucester, but this is the prevailing condition. And what they do is to say, we're going to try to find a way in how you contract the virus. So I was reading a newspaper article. They give them food that flu epidemic people have eaten, nothing. They stuff stuff down their throats, stuff stuff in their ears, stuff in their nostrils. They bring other sailors in who are sick. And they say after a month, these 50 men are so healthy and so strong that they form a boxing club because they're quarantined. And the only accident was that one of the guys got a fractured jaw from boxing, right? So here it is. I mean, we're in a world where the newspaper and words whispered on the street are the only way to communicate. When the Addison Gilbert Military Tent Hospital is set up, and I sent you an updated version of the photo of the tents, which I hope you might be able to show in the edited version. Without looking at it, I can tell you what fascinated me was you'll be able to see the number of wooden boardwalks that line the tents, which I'd never observed. That's what the nurses walked on. There was a protocol not even to touch the ground. Okay? The protocol that was established, we wear cloth masks now and face masks. For the 1918 epidemic, the nurses at the Addison Gilbert, the masks were a wire frame that went around their face, much like a hockey goalie's mask. The cloth never touched their nostrils, never touched their mouths. Every 2 hours, the masks were changed, washed, and fresh ones were put on. So the burden of the support, given that so many of the qualified nurses were still in the foreign theater, was for the young women of Gloucester who worked as laundresses, who ran messages, who drove the ambulances, who were aides. In the photo from the Addison Gilbert, look at it closely, you'll see some of the women on the boardwalks are uncapped, not wearing caps. And those were probably the nurses' aides. Even the concept of a nurse's aide was something that educationally and financially was being invented on the spot in it. So it was, I need to refer to my notes here if I may. What else was there?
Les, are there any accounts from these young women who were working in Gloucester to support this?
Not yet. You know, I can hardly wait for the KPN Museum to reopen and for the library to open because I don't have access to the Gloucester Times, which would be giving, you know, the day-to-day accounts. Right. Also, the Gloucester Fishermen's Institute. I'm quite interested to see where the Fishermen's Institute was such a bulwark of support for the fishermen coming in, how they responded. I know that many soup kitchens were set up throughout Gloucester, and that food was taken from the soup kitchens to Addison Gilbert, and also to many of the homes of the poor people who could not afford private nurses or private doctors, or who were not in some way already inculcated at Addison Gilbert. You know, there's a fascinating counterpoint because on October 2nd, when the 13 residents of Gloucester die and the military says, we're going to set the tents up, that's when the Gloucester Leonard Haskins Hospital reopens. And in talking with Gwen Stevenson, they did not set tents up on the property. They had 30 beds. And the beds were really reserved for pneumonia cases.
Excuse me, you meant Rockport.
Rockport, yes. Yeah. And Rockport's soup kitchens paralleled Gloucester's effort, which was much of the food was delivered to people in their homes who could not afford private care and yet who needed care. Because the same day on October 2nd, there were 13 that died in Gloucester, 4 died in Rockport.
It must have been so terrifying for this small community to not know where this was coming from, to have so many people become sick so quickly and not understand it.
We don't, a part that doesn't parallel is that, you know, the Great War over there has been going on. The boys are going over. There's all this incredible effort to raise money for all kinds of support for the Red Cross, many, many things. And now it's 1918, and suddenly there's the specter of this flu, which is invisible. It's not a German coming over the trenches. It's not a trench war. This is a germ war, and there are no boundaries. What's been fascinating is to see the ads in the newspapers that follow subsequent to 1918. There's a great ad from a company that makes men's winter underwear. And the ad reads, well, the best way to protect you against the flu is to keep the body warm. And we've got the right priced underwear that has more ribs per inch than the higher priced underwear does. So you start to see these kinds of changers of how industry is adopting to this big unknown, whereas the germ squad's proof, they still to this day, they have no idea. They really don't. Think it was a bird, they don't know. This all sounds very familiar. How Gloucester comes out of this is if you go from 1919 to 1923, where it's the 300th anniversary, there is a great celebration that takes place. In this celebration, I haven't been able to track down any recognition or pause because of the flu epidemic. Gloucester was well healed to pause for the loss of fishermen. So this was a specter that hit all of Cape Ann, that hit all of Massachusetts, that hit all of America in a way that could not be fathomed and could very easily be forgotten because it didn't have a trail of Studio 1623 or a cable TV or smartphones and all this way of digitally storing things. Okay? So a different tactic. It became the first great forgetting. We go into the Roaring 20s. We go into the Depression. We go into the Great 30s, and things continue.
I have to apologize for the beeping. There's a truck in my yard.
Okay.
Sorry about that. Well, that's wonderful, Les. So, and I understand we may talk to you about motif number 1 in another.
There's a crucial connection. I think it was off camera, Corey, at the first time you said, well, what happens after 1919? And I kind of surprised you by saying, well, Gloucester really embraced tourism. Mm-hmm. And there is this fascinating cycle, and we're still living in it. Think of it. We were a summer community for the rich and the elite through the turn of the 1900s. Okay? And I think that one of the lessons from the pandemic in 1918 was that Cape Ann needed more people with more money and more disposable income. And it was in 1923 that Gloucester starts to study building a second bridge. They picked a location for the 128 bridge, and it's built. And I hope I get the chance to talk about the story of the Motif 1 float in 1933, because by 1933, all of America was embracing the slogan of science creates and man obeys. And into the midst of that, and the Chicago World's Fair that was focused on that, there sailed this little float of the atmospheric seaport village of Rockport. So I have one more thought on the pandemic and the research that I've done. Just as it's frustrating that we don't know where COVID-19 is coming from, and it leads to a lot of social distancing and social discomfort. Imagine what it was like for the people in 1918, where there was no phone, there was no TV. There was nothing other than a newspaper and looking out for yourself and your neighbor. And what it's underscored for me is the real importance to respect history. And I'm eager as heck to get back into the Cape Ann Museum and the Sawyer Free Library to see what the newspapers at that time can contribute to bring more of the names of the local people and how they contributed, because it was truly a community effort in Gloucester and in Rockport to see through the days and see through the hours of this horrible event. So to more research, maybe it'll be a part 3 once we get back to everything, folks. Thanks so much.
We look forward to that, Les. Thank you.
You're all welcome. Bye, Corey. Bye, Heather.
Take care.